but we also then give you the chance to ask your questions after the briefing by the Africa CDC. And as usual, we have with us the director of the Africa CDC, Dr. John Nkengasong. He will start by giving us a brief, and then after that, we will go. If I can just brief you on how you can ask your questions. You can send your questions to this WhatsApp number, +251 945 502 310. Let me repeat that number, +251 945 502 310. For the colleagues who are joining us live, you can also write your name and institution in the chat section on the screen, and you will be allowed to ask your questions directly online. In case you might be having challenges with audio or any other challenges with the streaming service that you're on, I just want to remind you that we are coming to you on a number of platforms. So we are coming to you on Blue Jeans. We are coming to you on the African Union live stream, which you can access from the African Union website. We are also coming to you via our YouTube channels and also via Facebook. So you have a wide choice to select so that you can tune in. All right, let me now hand you over to Dr. John Nkengasong for the briefing for today.
Thank you, Wayne, and good morning, colleagues in the room, and good morning, colleagues in the media who join us every Thursday for this important briefing. Continue to express sincere appreciation for the partnership and collaboration that exists between the African Union Commission, the Africa CDC, and the media. As I've always stated, we need that tight cooperation to fight this enemy. Then I would do three things, actually. One is to go through the epidemiologic situation, and then also update you on the activities Africa CDC is doing, and then what we plan to do in future. So first of all, as of 9 a.m. East African time today, the global number of cases of COVID-19 infections have risen to over 7 million infected people, with over 400,000 deaths. On the continent, 209,000 cases, and to be very specific, 209,000 cases, 95,273 individuals who were infected recovered. So we have to always celebrate that. Since the last briefing, that is between the 4th and 10th of June 2020, there have been an increase of 23% in case COVID infection, that is new cases. And this represents an increase of 46,110 new cases and 87 new cases reported per day across the continent. Let me discuss with you the variation across the continent. This week, the Southern Africa region accounted for 40.2% of cases, or 18,530, with 24%, representing 11,125 cases. West Africa region represented 16.5% of new cases, that is 7,590, and East Africa 10.6%, 3,966 cases. That is the distribution across the continent. 5 countries continue to account for a large number of cases, of caseloads, and I'll walk you through those. That is Africa with 55,421 cases, Egypt with 30,073 cases, Algeria with 10,484 cases, and Ghana of all cases reported on the continent. It is important to note that the Sahrawi Democratic Republic is still the only African country without cases. Let me now switch over to some of the trainings that we have been doing to support member states. The Africa CDC has held joint training, and these are all in detection center, hygiene and waste management. As we all know, as we deal with any infectious disease, there's a strong possibility and account that you will generate a lot of waste, and we are taking care of that. A series of webinars on knowledge management focused on the effect of lockdown in Africa has started. Over 220 participants. That is just for this week. So we continue to train a large number of clinicians that will be responsible for managing the continues to make progress in terms of contribution to international clinical trials for drugs, mainly, or therapeutics. And as such, we've recorded 41 international clinical trials that have been registered on the continent. So I'm very encouraged with that. Just a few weeks ago, we were at 29 trials that have been registered on the continent. As of June 9, a total of 3 million tests had been reported from the member states, and that represents on this forum. Our number of testing has been low, but it's good to know that we are in the right direction. Just to put that in terms of the tests per million population, it will